So I don't know which of these I'm supposed to use. We have this brand new podium here that we're very excited about. We're especially excited, frankly, because this entire meeting is being webinared, and while there are almost, I think, 120 or something registrants to be here in person, and I know a couple people may not make it because of all the weather problems we're having, although it's kind of nice out right now, but we've got almost 600 people signed up for the webinar. So with having this new podium, this new way to show the slides, I will request that everyone, any questions, any comments, when there are times, make sure you go to a mic so that all of our guests on the webinar can hear you, as well as we'll be able to respond to them. So again, I'm really happy to have you here. I usually welcome you to the southern part of heaven. It has not been kind of sunny here. It's been kind of cold, although I have to say I was in Connecticut this weekend, and anytime we complain, we better stop. Because up there, you know, it was -2 to about 12. You basically walked through, you almost felt like you were walking through a tunnel because the piles of snow were so high on either side of the roadway or stuff. And here, you know, 5 or 6 inches of snow shuts us down for days. This was the first day I think kids were back in school in almost 2 weeks from very, very few inches of snow. So welcome to North Carolina. But anyhow, the topic today is of extreme importance. I have to tell you, there were 2 papers that I saw last week that just came out that kind of, you know, hit on this. One was called "A Small Study Finds Sleep Loss May Cause People to Consume More Fat." Thought that was pretty interesting. An environmental impact, sleep loss. And the other is the mouse study suggests 2 emulsifiers are linked to inflammatory bowel disease and metabolic syndrome. So, you know, things that we consume, things that we inhale, things that we may get through our skin may have impacts on us. As Frank said, and I think everyone in this room and on the web is familiar with the fact that childhood obesity has more than doubled, and it has more than quadrupled in adolescence in the past 30 years. I can remember, I guess it's more than 30 years ago that I was in school, but I can easily remember that every class, in a class of 30, you might have 1 fat kid. Well, today, if you go to the mall and you just watch children walking by, it's a lot more than 1 in 30. In fact, the incidence in childhood obesity is about 17 or 18% and continues to rise. And I think you're all aware of the fact that adult obesity in the United States, over 2/3 of our population is overweight, and over half of those are actually obese. This is a tremendous health problem that we're dealing with. And I should say that it is not restricted to the United States or technologically developed countries. This is a problem which is increasing in all the low and middle income countries as well. I think we know that there are ways that obesity can be at least prevented or reduced, and some of it, and as Frank said, much of the issue is what you eat and whether you exercise or not. And I am never going to give anyone a buy on exercising and eating you know, all kinds of fatty foods. We should remember that the cheapest foods are often the ones that are worst for our health. But the question we have to be asking is, are environmental chemicals putting us all more at risk? Is it making it harder for us to be able to control what our weight may be? And the economic costs for obesity are humongous. In the United States alone, we estimate that almost $300 billion are spent related to health care issues related to obesity. In some ways, it's a little bit like watching a train wreck in motion, slow motion. The public health and scientific community has seen the problem loom ever larger and seems almost powerless to stop its advance. We've tended to blame fast food, and we've tried banning huge sodas. We've inverted the food pyramid and issued ever-changing dietary guidelines, including last week. We've told children they just need to move more, but each of these efforts has really failed to stem the tide, and the people in the problem continue to grow larger. In part because there is no single or no simple answer. The complexity of obesity is really rivals that of cancer. And just as cancer is often the result of a mixture of factors, so too the development of obesity is dependent on a complex interaction of genetic and environmental exposures, including those that may have occurred in prior generations, and including our behaviors. So the purpose of the roundtable in the next 2 days is really twofold. We want to try to tease apart the interaction and to reinforce the concept of obesity and the attendant comorbidities, such as diabetes and metabolic syndrome, as a multifactorial outcome. We'll do this. We've got an exciting series of presentations and discussions on looking at some of the most innovative research being done in this area, looking at factors including epigenetics, the effects of dietary and environmental exposures on our endocrine systems and microbiome, and the risk of obesity across the lifespan. And finally, we'll discuss thoughts about what type of research and policy paradigms may best lead to some solutions. So I really am encouraging everybody to participate fully in the next 2 days in the discussions, whether it is by on the web and sending in questions to us, or here in person at NIEHS to put forward your best ideas and observations so we can move towards a future in which obesity is no longer a public health burden that is actually larger than life. And before I turn it back to Frank, I realize that we should probably, unless someone else is supposed to, tell you where the cafeteria is and where the restrooms are, in case. The restrooms are out both of those doors. There are some to the right towards the front of the building and some on your way to the cafeteria, which is right in the back. And for those of you who have never been here, at some of the breaks, if you're interested, some of us will be happy to show you around a little. So with no further ado, I'll turn it back to Frank. Thank you.